This is Wellness Wednesday, brought to you in part by Intermountain Healthcare.
It is Wellness Wednesday, and we are talking with a local medical expert about COVID-19 here in Utah and how our hospitals are dealing with this pandemic. I'm joined by Dr. Eddie Stenham. He's an infectious disease doctor with Intermountain Healthcare. Dr. Stenham, first off, I just have to say thank you to you and everyone else at Intermountain Healthcare for battling this pandemic right on the front lines. I know it's a stressful time, so thank you for taking the time to be with us. As of this afternoon, we have 1,012 cases of COVID-19 in the state. What is your assessment of those numbers?
Right. This is really what we anticipated. We anticipated numbers to increase over the past week to 10 days, and that's what we're seeing. And we expect that these numbers to remain consistent. And I think really the next 7 to 14 days will really be telling in terms of which direction this epidemic goes.
So far, what is most encouraging or perhaps discouraging about the battle we're fighting here in Utah, also nationally as well, with the numbers and trends we're seeing?
Yeah, it's very encouraging here in Utah to see Utahns really take to social distancing, really hunker down at home, limit their contact with their social gatherings. And it's really been great to see that the whole community is really taking that to heart. In addition, what we're seeing is that we have a pretty consistent rate of positivity number of tests that we've done. So approximately 5% of the tests that we've done on a daily basis have been positive, and that number's been relatively consistent. We haven't seen that number really go exponential. And so we're encouraged by that, and we will really be following that over the weeks to come. What we're seeing across the nation is really what we anticipated. We're seeing large urban centers really struggling with COVID-19, particularly New York City, New Orleans, and now looking at Detroit. And we'll likely see that continue to spread across the U.S., especially in our urban centers.
Social distancing is so important. Dr. Stenham, give us an inside look. Tell us what it's like right now at Intermountain Hospital and the emergency rooms. Are they overcrowded? How is your staff holding up? Kind of give us a virtual tour through your words right now, what it's like.
Sure. Intermountain Healthcare has done a lot to both protect our community and also our caregivers. We've canceled elective surgeries. We've really minimized non-essential visits to physicians and advanced practice providers. We're shifting a lot of our care to telemedicine, so those patients do not have to come in and be exposed to the public and to other providers. Because of that, we've actually seen our numbers in the urgent care actually decrease. We're seeing fewer patients coming into the urgent care, but the ones that are coming into the urgent care in the ED are needing to be evaluated for COVID-19. This has allowed us to really focus on our personal protective equipment that our caregivers wear to ensure that we have that capacity to care for these patients. In the hospital, caregivers are concerned. They are concerned for their own safety, and we are doing everything to keep our caregivers safe. And at this point, we have the appropriate supplies of personal protective equipment, and we have enough staffing and beds to care for the patients that we're seeing at this moment. It's really critical for us to continue this trend and not see an exponential rise in cases. And so we can really stay under that threshold of our healthcare capacity. And the way we do that, social distancing. We need to continue to do that, continue to self-isolate in our homes, limit our contact to large groups with the whole sake of decreasing the burden on our healthcare industry.
Dr. Stenham, before we let you go and get back to your important work, in your professional opinion and what you've been seeing, how long is COVID-19 going to be with us here in Utah, and how long will we have to continue our social distancing?
Really great question, timely question that nobody really has an answer to. If we do social distancing well and we do it appropriately, which I think we are in that direction, we actually see a longer time we need to remain socially distant. We want that peak to come later, and we want it to be lower. And so I think it's easy to say at least another couple months that we are going to be in this intense phase of social distancing. And then we'll just have to see and reevaluate on a week-to-week basis. But I can't anticipate us breaking from social distancing anytime before 8 weeks from now.
All right. Dr. Eddie Stenham with Intermountain Healthcare, thank you for your time and keep up the fantastic work. We appreciate you.
Thank you.